In 2004, at age 26, I decided to get breast implants. The reason I did so was to return my breasts to the fullness they once were prior to pregnancy and breastfeeding my son. I was extremely happy with the result. My implanting surgeon was great and did a wonderful job. I had 430cc and 470cc subpectoral. I had lovely breasts again. I healed well and was really happy with the result. It was immediately that I noticed that I was always short of breath. My level of fitness and endurance declined dramatically. I was no longer able to get fit or improve my fitness as I simply could not. I was a runner my whole life and competitive as a teenager, so exercise was easy prior to getting implants. I just attributed it to getting older and being exhausted from having a young child and working shift work. Only a few months after implants, I developed a horrible cough, which I would describe as being like whooping cough. For 2 weeks, I would cough and cough till I couldn't breathe. No phlegm, sputum or runny nose, just a cough. It resolved, so I thought nothing of it and put it down to having a subjective case of whooping cough. Not long after this, I started getting recurrent herpes infections. I had one outbreak while at uni 5 years before, but now they were chronic and there was rarely a time when I didn't have a cold sore around or in my nose. This was controlled with medication, but the medication gave me deranged liver enzymes. So basically it put me in a bit of liver failure. In 2006, I developed chronic tonsillitis. I would go on antibiotics, and as soon as I finished the course, it would come back again. I tested negative to Epstein-Barr virus, which is glandular fever, and no one knew why I was getting sick. So I was referred to a cardiologist to check out my heart. I was born with the VSD, which is a hole between my ventricles. So seeing a cardiologist was just to rule out whether I had developed any related issues. I was always told that I would never have a problem because the hole is so small. But because I was unwell, the cardiologist performed a CT pulmonary angiogram to see whether I had any clots in my lungs, causing me to be short of breath, and then continued with right heart studies in cath lab. This involved puncturing my right femoral vein and artery to be able to investigate pressures in my heart. There was enormous amounts of radiation involved in all of this. Finally, with this done, they could find nothing wrong with my heart other than my known VSD. So I continued to get sick with tonsillitis until I had a tonsillectomy. This put an end to the tonsillitis, but the herpes infections continued as I couldn't take the medications due to putting me into liver failure. Up and including 2007, I started to have difficulty word finding and I would constantly have brain fog. I felt like I was losing the plot sometimes. I felt extremely anxious all the time, lightheaded. It was hard to swallow, palpitations, sweating, and the list goes on. I developed swelling and rash over my left breast. Despite these physical signs, I persevered and just thought I had developed an anxiety disorder. Following this, I began to feel like I had the flu all the time. I would have aching all over my body accompanied with fatigue. In September of that year, I woke during the night with delirium and rigor. I persevered at home for a whole week before seeking help. I thought I had the flu, and the message was, at the time, to stay at home and get well. The thing is, I kept getting worse. My temperatures were really high. I lost 6 kilos in 1 week, and no one else in my family was getting sick. Upon seeing my GP, I was sent to hospital and was later diagnosed with strep mutans bacterial endocarditis. Strep mutans is a mouth bug, and sepsis from this is usually from a tooth abscess or problem. I had neither of these. I'd always taken good care of my teeth, and there were no infections, pain, or inflammation in my mouth, nor had there been. Following treatment with IV antibiotics through a PICC line, I continued to feel sick. My cardiologist said I should feel better. Even though I was not septic anymore, I felt sick every day. I had 3 episodes where I collapsed. My cardiologist suggested I may have had small strokes from the microemboli sloughing off from the vegetation that was in my heart when I had the endocarditis. So the flu-like symptoms continued every day. I went to my GP who diagnosed me with depression. So here I was thinking that I was depressed and my brain was making me feel sick. I felt nauseated all the time, fatigued, fluey, recurrent herpes, brain fog, difficulty word finding, difficulty swallowing, night sweats, day sweats, funny body odor, rash over my left breast accompanied by swelling, no energy, palpitations, and the list goes on. And you might be wondering, and no, the antidepressants didn't fix these symptoms, but they certainly did, however, make it more able for me to cope with being unwell. Sorry. Then I developed a lump in my armpit, arthritis in the fingers of my left hand, numbness down the underside of my arm, and I would wake during the night because my left arm would have really painful pins and needles in it. Then I started getting pins and needles in my legs and feet. I didn't know what was wrong with me, but resigned to thinking it was all in my head. At a follow-up appointment with my cardiologist, approximately a year after endocarditis, I asked if it was possible that if my sepsis with the bacteria could have come from my implants. He said that it was quite possible but difficult to prove. It was then I thought, if a bacteria can harbour around an implant and cause this, then is this why I'm feeling sick all the time? Am I battling a continual infection around my implant? So after this I went home and Googled it and came across Dr. Susan Kolb. I immediately ordered her book and not long after it arrived. While reading her book, I realised that all of this may not be in my head. My implants could in fact be making me deathly ill. I went to my implanting surgeon and explained what was happening to me, and he assured me it was not my implants. He said he had removed them for women who complained of these things, but they were crazy. He told me I had something else going on, but it wasn't my implants. I asked him about women who have had silicone travel to the lymph nodes, joints and liver, even when the implants are intact, and he said, yeah, this does happen. This in itself was enough for me to want them out regardless. So armed with the information I needed, I sought help from another surgeon. He too told me that implants don't make women sick, but was willing to remove my implants and perform a full capsulectomy. I was encouraged to replace the implants, but there was no way I was going to do that. I didn't care what my breasts looked like, I just wanted to get well. In 2010, I had an explant and my surgeon removed as much capsule as he could without removing my pectoral muscle and causing damage to my lungs. I asked to keep my implants and he said no problem, but after the surgery I was told they threw them out. I had no problem healing and used Fixamol on my suture lines for 3 months, just like I did when implanted. I have minimal scarring. I do, however, have no sensation in my left breast under my nipple and my whole nipple. Despite reading Dr. Susan Kolb's book, I went into explant with low expectations. I still had my reservations about whether or not the implants were making me sick. I still thought it was possible that I was psychologically unwell. Immediately following my explant, the numbness, pins and needles, arthritis in fingers, shortness of breath, difficulty swallowing, rashes and swelling, brain in my left breast, brain fog, word finding, this all resolved. Every day I got better and better. It was 6 months following explant that I was able to run a half marathon in 1 hour and 48 minutes. I continued to supplement my diet with B vitamins, lysine, coenzyme